29th October of every year is celebrated as World Stroke Day. Why is it so? Because stroke has become such an important disease with high morbidity and mortality across the world in all the societies. Hence, to create an awareness on stroke and its manifestation and treatment availability has become very important. So, what is stroke? Stroke is basically a disease. It's a condition where there is a sudden stoppage of blood into the brain. That can happen because of blockage of an artery or because of rupture of a vessel. And this blockage of artery causing stroke is about 85% of all stroke. So it's very important for us to be aware of this stroke, hence we can help the patient better. Most of the time we see that even if the patient is having stroke, the patient himself or the nearby people, they are not able to understand that the patient is having stroke. Only when we are able to diagnose that he is having stroke, then we can treat it better. So how do we identify stroke? Suppose you are in the office, you are at home, you are with friends, you are at a restaurant. If you see that suddenly a person's face is drooping towards the other side, the saliva is coming out, the face is becoming bent, then you think that the patient is having stroke. Second thing, the patient was perfectly fine, the gentleman or the lady was fine, then suddenly he or she become weak on one side of the body, then the patient is also having stroke. The other one is that suppose you are talking to someone over phone even, and suddenly the person is not able to speak, or the person who is sitting in front of you has slurring speech or difficulty in speech which is suddenly happened, otherwise he was fine, then you suspect stroke. So for suspicion of stroke, we should remember FAST, F-A-S-T. F is a facial weakness, A is an arm weakness, and S is a speech weakness or slurring. Then the person is having stroke. Immediately we should identify and take the patient to a hospital, nearby hospital, where we have 24/7 emergency and facilities like CT or MRI. Why it is important? Because once we do a CT or MRI, we can diagnose what kind of stroke we are dealing with and we can start the treatment as early as possible. Here at Medicover Hospital, we are running a tertiary care stroke center where we have facilities for medical, surgical and interventional therapies for stroke. The most important thing that has happened recently is a IV therapy or intravenous thrombolysis for stroke. If a person has stroke of the brain and he comes to us within 4.5 hours, then we can give an injection to burst the clot and we can reverse the effect of the stroke. And if the person comes beyond 4.5 hours, then we have a facility of intervention where we can go from the groin, get inside the brain and take out the clot, remove the clot. And that can happen in many cases up to 24 hours. So hence it is very, very important for us to identify stroke as early as possible because time is brain. The minute that we have lost 1.9 million cells, the neural cells in the brain. Hence, we have to act really fast when we are looking at a patient who is having stroke, and we should rush the patient to a nearby hospital and if possible to a stroke center where all kinds of treatment for strokes are available. Thank you. Have a healthy and happy stroke day.